Hi everyone, this is Dr. Guan. Today I'm going to talk about diabetes. So diabetes is a very common medical condition. Every day I probably see about 1/3 of my patients, they're already taking medication for diabetes or they are in the pre-diabetic stage. So there's a lot of topic I can talk about regarding diabetes. But today I'm going to focus on the 4 diagnostic testings for diabetes. 1. Random glucose test. So this test can be done anytime. It does not require fasting, so you just go to the clinic, get your lab work done. If your random glucose is above 200 and you have signs and symptoms of diabetes, then you have diabetes. What's the symptoms of diabetes, you may ask? Typically, patients complain about thirst. They want to drink water all the time. They want to go to the bathroom all the time. They may feel very, very tired. They may have vision blurriness, or they may have unexplained weight loss. So all these are symptoms of diabetes. So if you have glucose, random glucose above 200 and having symptoms of diabetes, then you have diabetes. However, if you don't have any of those symptoms, then we typically will repeat your lab work. If on the second time your random glucose is above 200, then you have diabetes. 2. Fasting glucose test. So for this test, it requires 8 hours of fasting. You cannot eat food or drink except water for at least 8 hours. Then get your blood work done. If your fasting glucose is less than 100, you're good. No concern for diabetes. If your fasting glucose is from 100 to 125, then you're in the pre-diabetic stage. If your fasting glucose is 126 and above, then you have diabetes. 3. Hemoglobin A1C, also known as A1C test. So for this test, you also do not require fasting. You can go anytime during the day. A1C test measures your average glucose for the last 2 to 3 months. So it gives your provider a broader view how your sugar is controlled in the last 3 months. If your A1C is between 4 to 5.6, then you're normal. If your A1C is from 5.7 to 6.4, then you're in the pre-diabetic range. If your A1C is 6.5 and above, you have diabetes. The last test is called oral glucose tolerance test. Typically, we use this test in pregnant patients if we have any concern for gestational diabetes. But occasionally we also use to check just regular, type 2 diabetes as well. This testing is also a fasting lab work. You need to fast at least 8 hours without food or drinks except water before the test can be done. So you come to the clinic, we'll check your fasting glucose. Then you get to drink a special glucose drink. Then we check your glucose at 1 hour post and 2 hour post. If your sugar level at 2 hour post is less than 140, then you don't have worries for diabetes. If your number is from 140 to 199, then you're in the pre-diabetic range. If your number is 200 and above, you have diabetes. So in my practice, I like to check fasting glucose because usually I check for patients other lab work as well, such as lipid panel, which require fasting blood work. So I can see their fasting glucose. If they have any concern of glucose, if the number is high, then I will use A1C to confirm their diagnosis. Also, A1C is the test I typically use to follow patients who already have diabetes to see how their treatment's working for them. A1C goal for anybody who has type 1 or type 2 diabetes is less than 7. Now, that number varies a little bit, depends on your age, depends on your other medical conditions. The younger you are, sometimes we are a lot more tighter on your A1C goal. Sometimes we want the younger patient to really get to as normal as they can. But for older patients who has other, medical conditions, if they're in their 70s and 80s, then sometimes the A1C goal can be a little bit more relaxed. It's okay for them to have maybe 7.5. So everyone is different. This is it for today. Thank you for watching my video. I hope this information is helpful. Next week, I will be talking about diabetic diet. So please subscribe, comment below if you have any questions. I will see you next week.